Okay, here's a brief video on how to use the Add Shape tool. On this case here, we are going to be focusing in on just the lower teeth. And at first glance, it doesn't look like this case would require a whole lot of tooth movement, but in my opinion, it actually does. So when you look at the root angulations here and the potential tipping that should be done in order to achieve a good result, it actually is a fair amount. So I've already created the ideal setup, okay? And typically what I do is I first create the ideal setup and then look at my tooth movement chart here and I look at all the largest displacements, okay? And whatever large displacement that I pretty much now know that I should really take a close look at that tooth and evaluate whether or not I need to place an attachment. The other thing that's really nice about this is that it shows us exactly which directions the teeth are moving, and then we know there's certain directions that are very difficult to achieve without some sort of attachment or modification to the shape of the tooth. And that would be particularly extrusion and also torquing and tipping and rotating. So in this case here, we'll just go, I just go down the list here of all the teeth, and the first tooth here we've got is the lower right cuspid here, okay? And you can see I've done some tipping to the tooth, not a whole lot. I mean, we can go back and look at, here's the beginning, and here's the proposed setup here. I just didn't think this patient really is just looking for minor realignment. I didn't think it was really, I guess, worth the time and cost the patient to completely upright this tooth. But I did upright it to a point where it would give me a much improved overall arch form. So you can see here, let's rotate around to the occlusal here, and you can see the beginning. So here's the initial, and then here's my ideal setup. Okay, so I'm getting back to the facial perspective here, and we're going to focus in on the first tooth. I'm going to add a small shape to, and I'm going to go up here to add shape, click on small, and then I'm going to click on this tooth here right in the center. And I always, I'm going to bring up the upper here because you always have to keep in mind that you don't want to place these geometries in the patient's occlusion, okay? So now I'm going to resize and reshape this a little bit. And I like to, the higher you place the attachment towards the incisal ledge, the more retentive and the more force that attachment is going to be able to place onto the tooth, the higher you get towards the incisal edge, okay? Just because the plastic can exert more force up here than it can down here. Okay, so I like my positioning in terms of incisal, gingival, mesial, distal. Now the next step is I like to rotate around to just the profile view of the geometry, and I'm going to click on the attachment again, and now I'm just going to submerge the attachment into the tooth. And this is part art and part science. So I also like to do sort of a bevel, and I'm going to do that. Okay, and let's just look at this from the occlusal perspective and see if I have that position where I want. And now looking at this tooth, we also are doing some rotation, I believe. Oh no, we're not doing rotation on this tooth. So I'm going to just take and center this tooth a little more in the mesial, well, in the center of the tooth, and I'm also going to increase the width just a little bit. Okay. And again, this is part art and part science. I mean, it just kind of takes a little bit of a feel to get it. But then I would be done with the attachments for that tooth. And now we're going to go down the line here, and then our next tooth is going to be this central incisor here. And the central incisor, you can see, has a lot of tooth movement in a lot of different angles. Okay, so the first thing we're going to do is turn on the upper. So I just make sure I'm not going to be placing the attachment into the patient's occlusion. So I'm going to place it right there. And again, I like to place it almost as high as I can. And now remember, you need to check the beginning as well as the final, because you may be doing a lot of intrusion, and so you have to make sure that you're placing the attachment where it's not going to be in the patient's occlusion at the initial tooth positions, not where they're going to, because you could be placing the attachment in the patient's bite initially, but as the patient's bite corrects, it would not be in the bite. So I always just I check both. I check the beginning and then the proposed setup, okay? So let's go ahead and turn off the upper, and same thing, I'm going to go to the profile here, and I'm going to submerge it, and then also bevel it like so. And now with this too, since we're doing quite a bit of rotation, we have to think about how the tray is going to push, because all the trays can do is push. They can't pull really. So this tooth here is rotating counterclockwise. So we need to make as much surface area on this side right here so that the tray can push right there. So what I do in these situations is I like to rotate like this. And now the tray has all of this surface area right here to push on that tooth to rotate that tooth. And let's look at this from this angle here. Okay, looks good. Sometimes I will even place a attachment on the lingual as well. If we've got a lot of rotation, and it works really well because then the tray can push here and also push here on the attachment, and we get a very nice coupling effect that can really help rotate the teeth. So now I'm going to also, just for stabilizing, I'm going to place an attachment on the lower left cuspid here. And the lower left cuspid doesn't really, let's look to see how much tooth movement we have programmed in. So we have a fair amount. We've got 0.7 millimeters of facial movement, 3 degrees of rotation. So I'm going to actually place a vertical attachment on this tooth as well. And I'm going to go to small, click on the middle of the tooth. Again, turn on the visualization of the upper so I can see where I can place the attachment. I'm going to make this a little bit larger. Turn off the upper, and again, look at this from the profile. And then I'm going to submerge this. And increase the width a little bit here. Okay, so I would be done. Now, again, the key here is you also must always save and set up 0. So go to 0, then File, File, Save. And then the last step is going to be to determine how many intervals we want to create. On this case here, our limiting tooth is this that lower right central, and we've got 15 degrees of rotation, 6 degrees of tipping. So I'm going to actually do 6 intervals and see how this turns out. And so this is what I go with. I would go with 6 intervals for this case here. Okay, so now we're going to look at another case where we are doing some extrusion. So here's a case that we are trying to do some just pure extrusion of the the upper right lateral incisor. You can see how it's just not the same level as the the upper left lateral incisor is just not the same level as the right one. So here's I've also built a little bit of over correction, but you can see we've done some extrusion here of this tooth, and we've done about let's see here, we're extruding at about 0.16 millimeters per setup, and we've got 5 setups. So that's going to be right around 0.7, if my math is correct, around 0.8 millimeters of extrusion. Okay, so what I just was concerned with the size or the specific morphology of these lateral incisors, the ability to really extrude the teeth well. So you can see here is what I did was I placed an attachment on both the buccal and the lingual, and I made them so that we have diverging angles. And I'm going to bring this tooth out so we can take a closer look at it and analyze the exact fit. So here is the tooth, and you can see that when we have an attachment on both the buccal and the lingual, and they're angled in such a way that now the aligner can grab here and here, because remember, aligners can only push. So now the aligner can push on this angle here and this angle here, and then extrude the tooth. Okay, and this is exactly what I'm seeing on the patient. So here's here's some actual photos of the patient, and you can see here, you can't really see the attachment very well right there, but you can see it on the lingual here, and then on the buccal there, and then here it is with the aligner in place, and you can see how well that tooth is tracking. You can see that it's fitting perfectly in the aligner. I think this is at about setup number 3, I believe. So getting great results by placing the attachments on both the buccal and lingual, especially when we have unpredictable tooth movements to achieve. Okay, so hopefully this video has been helpful. Thank you.